Today I'm talking about osteoarthritis in women over 40, symptoms, causes, and treatment options. So, Sylvia was an 85-year-old active woman. And she came to me because she was getting more and more arthritis symptoms in her hands and her fingers. And that was impacting her ability to play tennis and do other activities. Now, let's talk about that. Did you know there are around 350 joints in the human body? It wasn't a problem for Sylvia until she started waking up with stiffness in her fingers and knuckles. And she came to me hoping she didn't have to take ibuprofen every day for the rest of her life. So, a couple of good questions. Are you waking up with stiff joints in your hands, in your shoulders, in your knees? Do you have swelling, stiffness, or pain impacting you daily and limiting your actions? No more pickleball, no more golf, or picking up the grandkids. So, osteoarthritis is pretty common. Over 32 million adults suffer from it, and it's the leading cause of chronic disability. I think we all know someone now who's had a hip replacement or a knee replacement from bone on bone osteoarthritis. So the questions I'm going to answer in this video: what is osteoarthritis? What causes osteoarthritis? How does osteoarthritis appear? And how can it naturally be prevented or reversed? So let's get started. So osteoarthritis is a combination of degenerating joint disease and inflammation that breaks down the hyaline cartilage in your joints. Now, common joints are the knuckles, the toes, and then, of course, knees and hips, spine, and any joint, really. Now, this can easily be diagnosed by simple x-rays, okay? What are the risk factors for developing osteoarthritis? Well, age, right? We do tend to see it in older people. Obesity, just because more weight puts more stress on the joints. Trauma, such as a joint that was fractured or broken at some point, injured. Genetics, whether it runs in your family or not. Reduced sex hormones. Muscle weakness would mean more strain on the joints instead of the muscles. Repetitive use, infection, diabetes, bad diet, which we're going to get back to, pro-inflammatory foods, and lack of good nutrients. So these are some of the etiological factors. Now, in conventional care, basically it's just taking NSAIDs, non-steroidal anti-inflammatory drugs, your aspirin, your ibuprofen, your naproxen. Still do steroid injections or hyaline injections into the joints. Of course, they'll do PT, trying to build up muscle so it takes more stress off the joint. Then, of course, if it all gets worse, joint replacement. Those are the main things that are used in conventional care. Now, the way I work with it in patients is first, to change the diet. The thing that I have found most substantial in working with osteoarthritis patients is removing refined sugar. In fact, there has never been a patient I've seen with osteoarthritis who didn't have a regular refined sugar intake, whether it's a cookie a day or a little ice cream or putting honey in your tea. It's sugar, and it is the most pro-inflammatory substance we can eat. So getting rid of refined sugar will help patients with osteoarthritis more than anything else that they do. Now, when I say refined sugar, that's what I mean. I don't mean fruits, not fruit, but the sugary junk stuff that I think you all know what I'm talking about. The second thing, we pull out the sugar, we add in omega-3s. So omega-3s are in foods: salmon, sardines, walnuts, leafy greens, herring, grass-finished meats and poultry, omega-3 eggs. These all have omega-3s in them. Of course, we can also take supplements on top of that, not instead of, but on top of. And those are incredibly anti-inflammatory. So we get rid of the most pro-inflammatory thing, add in the most anti-inflammatory things, and within a month, 95% of people are 90% better with arthritis symptoms. And that includes also removing junk food and fast food, and then being active, right? And do strengthen muscles so they take the stress off of the bones and the joints. Now, again, adding in supplements, for sure, we'd want to do fish oils. People talk, we can do glucosamine sulfate. And there's also chondroitin sulfate. Chondroitin sulfate is very hard to absorb. It's a very big molecule. So if you just get glucosamine sulfate, I mean, that's fine. It'll work just fine. We also can do curcumin, very anti-inflammatory and an antioxidant. We can also do cat's claw, which is kind of specific for the joints, among other things, right? You'd want to get a product. It's called Umcaria tomatosa. And you want to make sure that it has a lot more POAs than TOAs. So those are different alkaloids, and the best ones are the POA, not the TOAs. Also, boswellia, anti-inflammatory, good for the joints. Ginger extract as well. And then collagen 2 and 4 are for the joints. So taking a little collagen as well as the form that goes to the joints. So how did I work with Sylvia? Well, Sylvia, we discovered, had a little bit of a sugar problem. She didn't eat a lot of cookies and things, but she had sucking candies in her house. She played bridge and she had sucking candies around the house when it was at her house. And she would go around and eating 5 or so sucking candies a day, and they were sugar. And believe it or not, when we stopped her doing that and added in some fish oil, she went back to normal and didn't have any problems. Now, it's not always as simple as that, but sometimes it is. And what you eat can make a huge difference in how you feel. So, I hope you learned about the symptom, causes, and treatments for osteoarthritis in women over 40. Thank you.